For kids, this pandemic has meant disruption from top to bottom. Nothing as usual. Not sports, school, activities, time with grandparents, no birthday parties. And that's amidst families that are stressed as never before. How well are children and youth coping? Let's find out. We're going to ask in London, Ontario, Dr. Javeed Sukhera, Associate Professor of Psychiatry and Pediatrics at the Schulich School of Medicine and Dentistry at Western University. He's also a past president of the Ontario Psychiatric Association. In Mississauga, Ontario, Katherine Hay, President and CEO of the Kids Help Phone. And in the West End of the provincial capital, Sheri Turrell, clinical psychologist and psychoanalyst at Life in Balance Therapy and author of the Mindfulness and Acceptance Workbook for Teen Anxiety. And we're glad to have you three on TVO tonight to discuss something that sadly is very timely and important. We're going to start with some information from a SickKids hospital-led survey. This is a survey of parents and youth from last spring. The study found children and youth experienced relatively similar overall mental health impacts, no matter their clinical history. However, those with autism spectrum disorder, ASD, reported the greatest deterioration in depression, irritability, attention span, and hyperactivity. Having a pre-existing psychiatric or neurodevelopmental diagnosis was associated with both improvements and deterioration in mental health. One concerning finding for the study team was the significant proportion of otherwise healthy school-age children who experienced deterioration in a number of mental health domains, including depression, anxiety, irritability, and attention span. Okay, lots to dive into there. Javeed, get us started. What's your greatest concern about what's on that list?
I think my greatest concern is that there are a large number of young people who have significant functionally limiting symptoms that were having a hard time getting access to help before the pandemic. And clearly we know that in the context of a chronic stressor of the nature that we're all experiencing, people's mental health is going to deteriorate. So my biggest fear is that there are many people who are going to build up the courage to ask for help, and that we won't have the infrastructure to be able to meet that need, leading to prolonged waiting lists, problems with access, and ultimately worsening mental health for a lot of young Ontarians.
Kathy, to you next. I'm assuming some of the kids that have been reaching out to the Kids Help Phone for advice and assurance, well, I'm assuming those numbers have gone way up in the past year. Is that in fact the case?
That is in fact the case. And I do agree with Javeed that there was a problem before COVID hit, and lay COVID on top, and it has been an extraordinarily hard year. Our volumes have gone up about 140% across Canada to 4.6 million interactions with young people. And the acuity is high. Their isolation fear, it is all growing. I could not agree more with the Kids Help Phone or the SickKids study.
4.6 million interactions. Just explain what that means, if you would.
That is in every province and territory. 4.6 million times someone reached out to Kids Help Phone through any one of our service modalities. Mostly we will see it through self-help and self-directed tools, but right through to our professional counseling and our crisis responders.
And one more follow-up. I assume it's not only kids who are calling. I presume parents are calling as well?
Yeah, well, our typical day at Kids Help Phone is 5 to 26 is a typical day, but we also have parents, adults at 2 a.m. Quite frankly, we are the only 24/7 mental health solution in the country.
Sheri, it's been widely reported that young people today experience higher levels of depression and anxiety than previous generations. How has what they've experienced this past year added to that already established problem?
I think what I'm seeing in my practice is some of my patients were relieved at the beginning of COVID, much like the SickKids study reported. The social pressure was off. But in the last couple of months in particular, even those kids are not faring so well. And I'm getting a lot of new referrals for people who've never experienced any mental health struggles, many of whom are calling the Kids Help Phone as well. But I agree, I think what I'm seeing the most of that is really heartbreaking is the lack of hope. And the kids are really losing hope. They can't focus. They don't see a future. And it's just absolutely heartbreaking. And, you know, I think they're under a lot of pressure. This generation always has been. It's not new, as Kathy alluded to. But, I think they're told as young as grade 7 by their peers, by their schools, their families, and the world around them, you've got to get good marks to get into a really good high school and a really good university. And it has to be a prestigious one, not just anyone, so that you can get a really good job and make a lot of money. And the pressure's there. And then they have to solve the world's problems while they're at it. And this
I
is
would
just
love
all
to
making
disabuse.
it worse.
Yeah, forgive me. I would love to disabuse people of the notion right now that everybody's got to go to Harvard or Yale or their life is going to turn out to be a disaster. That's just, on the face of it, ridiculous. But
Yeah.
okay, Javeed, more than a year into this, what do you think has been the most damaging risk for kids, both now and in the long term?
The most damaging thing is really hard to distill, because I think this is like a complex chronic stressor that not just kids, but we're all experiencing collectively as adults. And in the context of that, what I've seen and heard with the young people that I work with really are two main concerns. The first is how this has affected learning. Now, there's no one size fits all. Everybody's different. Some people are actually thriving and doing okay. So we have to resist overgeneralization. But there are many young people who are really struggling with distance learning. They lack the kinds of individual supports that they need, particularly young people who might struggle with attention or learning difficulties already. And that's leading to further deterioration in their mental health. The other group are people who struggle with situations where there's high degrees of conflict in their home and they're feeling stuck. They're feeling like they don't have an outlet. And many of these young people, like was said earlier, are struggling with hope. And that's really what keeps me up at night, is that sense of dread and hopelessness, which is important for us as adults to help counter by sharing hope and spreading hope wherever we can.
Sheri, can I just follow up with you, because you mentioned hope as well. Is the loss of hope related to they think this pandemic's never going to end, or what is it?
I think it's probably quite multifactored. I think it is the idea that it's not going to end. The end doesn't seem to be in sight anytime soon. And I think it's just what others have mentioned around the loss of their peer group, their social supports, their extracurriculars. And I'm still hearing from many that the expectations aren't changing. They're still expected to do well at school, get their A's, attend class. And I think there's a real imbalance between what they're going through and how they're functioning and what's being expected.
Well, we should still, I should ask, I shouldn't assume. Should we not still expect kids to get good marks?
I think we can hope that they will. And I think when the moment's right, we can expect them to. Yet I think it just feeds into that pressure that I was speaking about a few minutes ago. Many of the kids I work with and that I'm hearing about from colleagues, they're happy if they get out of bed in the morning and eat breakfast. That at this point, especially in the late end, the end of the school year, they're completely exhausted. They have no enlivenment, no fulfillment. There's no spontaneity in their day. They are just dreading every minute of their day. So I do think that we have to listen to them and we have to dig into their experience and what they're going through. And I do think the expectations have to settle down a little. I think we've got to take our foot off the gas pedal.
Now, Kathy, I don't know how to ask this well, so I'm just going to ask it, and it will be inelegantly asked, but you'll get the drift of what I'm talking about here. Of course, the kids that the three of you are dealing with are having among the toughest times in the country. Do you think they are reflective of the entire, say, under 18 population right now?
It's a great question. And we are speaking to kids in every province and territory. So I do agree that the sense of hopelessness, isolation, fear, there is a lot of fear we're hearing from kids across Canada right now, afraid for their own health, for their families, for well-being. I also agree that the isolation is creating different dynamics within the home, and the expectation day to day is really stressing our kids out. And we hear it every single day on our platform. So answering to your question, this is a national crisis that we are seeing. And I also want to make sure we remember that what we're going through now, and I do see a lot of hope actually from the young people that reach out. And the hope I see is that they are reaching out, that they are learning help-seeking behaviors, and they continue to do so. That is a really good resiliency coping mechanism that we are seeing at Kids Help Phone. What we worry about is the trauma that is coming from this past year. And let's remember, it's not just COVID, and it sounds weird to talk about just COVID because it's been pretty traumatic. But in there has been the shootings in Nova Scotia. There's been huge unrest around social injustice. And we saw major spikes on our platform around the murder of George Floyd and all the issues around social justice. So I am incredibly worried about this year, next year, the year after. And if we forget this trauma as a country and as a government, we will have let our kids down.
It is a lot to deal with, isn't it, for young people? They've got the healthcare crisis we're in the midst of, an economic crisis for many families, of course, who've either lost jobs or seen their lives turned upside down. And then the social justice reckoning that is happening, that's a triple whammy for a lot of families to deal with all at the same time. Javeed, we know the wait list for mental health services before the pandemic hit was already plenty high. Is there anything more beyond, obviously, I mean, I guess doubling funding would solve a lot of problems, but anything beyond that you could recommend right now that would bring more capacity online?
Well, I think you said the most important thing. We've got a persistently and intentionally underfunded system. It's continued to be underfunded despite successive governments, despite attention to the issue. So we need to do that. We also need to recognize that there's a distinction between people who are struggling with a normal emotional response to a stressor that are seeking help and support, and people who have more of that functional debilitation, who need a higher level of treatment, who need evidence-based health professionals who are trained to be able to support them. So what goes hand in hand with funding is people. We've got a mental health workforce in Ontario that's extremely stretched. There's only about 100 college-registered child and adolescent psychiatrists in the entire province. It's the same group of us that have been stretched more and more over the past decade. And I'm really concerned that there's a lack of health human resource planning, which is holding things back.
In which case, let me get your take on the announcement that the Ontario government made just this week, $80 million for mental health supports in the school system, 1,000 more mental health workers over the next couple of years. How would you characterize that?
I think it's promising. I won't say that it's a bad thing, but it's simply not enough. School mental health workers don't typically provide treatment. They can provide support, they can provide counseling, but we see most of the cases where there's significant clinical presentations presenting to mental health professionals who will continue to have waiting lists. I don't think that money is going to make a dent in the sort of atrocious fact that some young people are waiting 12 to 24 months for evidence-based treatment. So, it's encouraging that they're spending that money, but I would wish that governments would do less politically popular sprinkling of funds and do more sustainable annual operational investment in children's mental health so that kids don't have to wait.
Let me do one more follow-up with you, because I suspect some people watching this are not going to know the difference between a sort of politically nice sprinkling of funds versus what it is that you're actually looking for that's meaningful. Can you give me an example of the former and the latter?
Absolutely. So, the politically convenient thing to do is to sprinkle funds, into a unit here or a program there or a sector there, to have a photo op and to issue a press release. That's great. But what that doesn't address is the fact that people across Ontario are waiting up to 12 to 24 months for evidence-based care. And sustainable funding would mean sustainable dollars to community children's mental health agencies to invest in human resources, to pay salaries for people to be able to provide the treatment.
Now, Kathy, did I see right, or was it my imagination, that you did an announcement with a couple of cabinet ministers this past week?
Yes, you did see that right. Kids Help Phone has received good funding from Ontario this year to support the exponential growth that we have seen. I will agree that the ecosystem itself cannot be funded in pockets. So it's fantastic that young people can reach Kids Help Phone 24/7, and our wait is 3 to 4 minutes. And young person in suicide ideation, it's 40 seconds before we get to them. But that is a single session in a moment in time, and that is our job at Kids Help Phone as part of the ecosystem. For some young person to wait 12 to 14 months for evidence-based care is too long, and Kids Help Phone cannot sustain a young person for 12 to 14 months while they wait.
Kathy, I don't know if this is knowable, but do you have any idea how many kids you've talked down off the ledge, so to speak?
Mm-hmm. So about 20% of the work we do every single day is around suicide, ideation, self-harm in significant ways. That's every single day. And every single day we do between 10 to 15 active rescues, active suicide rescues, where there is intent, a plan, a means to end your life. And we do that every single day. So in 2020, we conducted more than 43, almost 4,300 active suicide rescues. That's in addition to the 20% of work we're doing, speaking to young people, building safety plans, getting them through to a good referral source. So yeah, it is a crisis in this country. And dare I also speak about Indigenous youth and Black youth who are really, really suffering through this pandemic, more so and in more acute ways. You're seeing that on our platform.
I want to make sure I heard you right there. You saved more than 4,000 kids from killing themselves last year.
Correct. That is correct.
Okay. And the money that you just got from Queen's Park this past week, how far will that go to helping you fulfill your mission?
So I am grateful for any funding we can get. It will help us to pay some salaries, make sure our service is 24/7. We rely on other funding though, so it will not close the full gap. Thank goodness we have other funding.
Sheri, let me ask you, is there any particular tool or technique that you apply when you are dealing with a young person challenged with anxiety or depression?
Oh, that's a big question that I could take all week to answer, but I'll try to distill it down. I do work mostly from a modality called acceptance and commitment therapy, or ACT. And rather than seeing it as a skill set, sort of here's a hammer, I'll teach you how to use it. It's really about teaching people how to have their thoughts and feelings, because I think there is a lot of pressure in the world that if you don't like your thoughts and feelings, you need to fix them, get rid of them, or shut them down, and you need to be happy. And humans are not happy all the time. So with ACT, the emphasis is really on how do you live with yourself and your inner self, your thoughts, your memories. How do you have a different relationship with that? And it's a lifelong practice and a lifelong way of being. The emphasis then becomes on who do you want to be, who's the person that matters to you, and who and what matters to you in your world, and working with people to help them really go in that direction, which with young adolescents and young adults is really wonderful because they're right at the age where they're looking for identity and meaning in life. And it's less about the outcome and more about the journey. So I find it really helpful to work with kids, teens and adults and parents around being able to have thoughts and feelings and not try to fix them and get rid of them.
Have you got a ballpark figure as to how many kids in a typical year you might help through the course of your work?
Not as many as I'd like, because I do a lot of individual therapy and see about 40 people a week. I think about 80% are teens. We have started to do a lot more online groups, and we're trying to get some workshops in place that could be offered Canada-wide so that we can reach people who don't have a lot of money, who can't come to therapy every week, so that we could do it more as a skills-based teaching. So we're working on it, but certainly not as much as I would like. And people aren't leaving therapy.
Right.
There's a real backlog now.
How much of the work that you do involves actually convincing parents in the first place that children need your help?
For me, not much, because they're reaching out to me. So it's kind of a built-in. I think the harder part is for me to convince parents that they might need some help. Because I think often when there's a highly anxious or depressed or inattentive teen, or just a teen who's struggling, parents are probably struggling too, and it's really hard to watch your child suffer. So I find more often than not, I'm also referring parents to places and trying to find them therapists that can help support them so they can support their teen.
Kathy, you got a ballpark as to how many people you've got working under your roof helping people out?
Well, that's a great question. At Kids Help Phone, we have about 192 clinicians on our phone and chat, and those are professional counselors for single session counseling. We also have an incredible technology in our texting platform, which enables us to train and support crisis responders, their volunteers. We have over 4,000 volunteers that support kids through texting, and that is on AI machine learning technology with professional counseling, an additional 60 or 70 people, professional counselors that oversee conversations in real time. So if it triages, and we triage based on acuity, not first come, first serve. If it triages with a suicide ideation or high issues, a professional counselor is right there. Again, with 3
Kathy,
minutes.
I always like to ask the helpers, because the helpers need help too from time to time, and particularly when they are, all day long dealing with some of the unhappiest and most anxious people in the country. How do you ensure that your helpers get help?
I thank you for that question because our helpers, our counselors, they are the virtual front line. Sometimes they are the only front door a young person could go through with whatever their issues are. So our counselors, they're all remote now. They used to be in counseling centers where they had each other and debriefing moments and counseling managers to counsel them. They're in their bedrooms sometimes starting work, and their first call could be a suicide or a mandatory report for abuse. The barriers are just so blurred right now for them. So we do a ton of self-care time. We make sure we reduce the number of calls or chats they take in any given day. We actually have paid sick time for our people as well, which we're really proud about. And we're just going to support them however they need because they're supporting kids in this country.
Javeed, I've asked this question of numerous doctors and nurses, so I'm going to ask you as well. What constitutes a good day in your life? Because I can imagine, if you're a doctor attending to people who are dying or a nurse attending to people who are dying in your ICU all the time from COVID-19, that's a hard thing to deal with day in and day out. So what constitutes a good day for you?
It's such a tricky question for me right now because I can tell you that the level of grief, the level of emotional energy that I would say and many mental health workers have had to invest this year has been unprecedented. And you add on that the isolation of not having a peer group that can be a support. So I've talked to many who've struggled, but your question was, what's a good day? And I would say I try to think of every day as a good day. I see it as a gift to be able to work with young people who continue to inspire me every day I work with them. A good day for me in the last 2 weeks was a young person whose life goal was to buy a house, telling me that they were approved for a mortgage, or a young person who struggled many months ago, who's finding that they're thriving in part-time employment and have set goals on something that they see as achievable. So it's really, to me, the energy, the enthusiasm, and the light and love that young people bring that makes a good day for me.
And what's the ratio between good days and bad days?
Well, you're challenging my framing there, Steve. So I'd say 100% good days. However, it's been really tough. I think when we're locked down, adults struggle too. And I can tell you, I have young ones at home. I have young ones who have their needs. So if their internet isn't working in the middle of a science test, and I'm fully present or trying to be fully present for a young person I'm trying to support, that can be tricky. The other challenge I find for many people is that because there's only so many of us and the demands are going up, there's a kind of moral distress that happens when you're, an intake worker, for example, and you have to tell a parent who's got a child who needs help that they're going to have to wait. And that takes a toll. And this year, it feels as though that toll just keeps accumulating and accumulating over the year. And I'm really concerned about what that experience is going to be like in the wake of all this for the people who are working day to day in mental health.
In which case, let me ask you the same question I asked Kathy. Who helps the helpers?
Well, I think we have learned to help ourselves, but we're really bad at that. People who work in mental health also struggle with, stigma around asking for help. Even though we cultivate hope in others, we sometimes don't practice the best care for ourselves. So, in terms of the help of the helpers, I think we need people who might be employers who are supportive, like Kids Help Phone, for example. But what we also need is a government that recognizes the work that we do, that honors the work that we do, and that invests in it, that listens to what mental health workers are saying, that listens to what young people are saying, and really promotes a narrative that shows that we can move forward in a way that meets that need.
Okay, you're going to forgive me this extra follow-up now because you just raised something that I can't let go. You said we need a government that ... Do we have that right now?
Frankly, no. Frankly, no, we don't. I'm going to say this very candidly. It's great to sprinkle money here or there, but this government has been in power for several years. They have not yet provided a sustained investment in children's mental health. We know that the return on investment is clear. A dollar invested in early intervention will save many dollars down the line. And what we've seen thus far from this government is sprinkling of funds here and there, no sustained investments. Every year before the budget, children's mental health agencies make it clear that $150 million a year can reduce wait lists to within 30 days. And that's not recommendations that the government has acted upon. And they simply haven't been listening. And those of us who work in the system and the young people and the caregivers that we serve, we've been shouting at the top of our lungs for years, and we haven't seen that sustained investment.
And to be clear, you're talking about the government of Ontario.
Yes, I would say the government of Ontario has not been listening successfully to the needs of children and youth who are struggling with mental health challenges.
Okay. In our remaining moments here, I do want to come back to the issue of hope. And Sheri, let me raise that with you because yesterday Health Canada did announce that they're going to recommend the Pfizer vaccine for kids as young as 12. And I wonder whether you think that might change the equation when it comes to hope for people of that age.
I hope so. I think it's going to depend, and that's my favorite answer for many things, on when it happens, and hopefully the optics won't be so chaotic. I think getting the vaccine out is a whole other issue. But I do hope that, once the vaccine is out, that is going to give them some degree of hope. But I think there's a lot of other issues, even, wearing masks and who's wearing them, who's not. A lot of people are telling me they don't feel safe because they don't know who they're walking past. They're not wearing masks, and we don't know everybody's story when we're walking past someone on the street, standing in line with them. And kids are feeling ostracized if their friends aren't following precautions and they have to. So I think it may help. I'm just not sure the overall impact with a lot of the other stuff going on systemically.
Okay,
they need
Sheri?
to see that their entire world can keep them safe.
Sure. How about some advice for parents right now? We heard you refer earlier to the fact that maybe now is not the time to be pushing kids to get straight A's in all their classes. Okay, a little bit more advice for parents as they navigate the next few months.
I think for parents and teens, really take our feet off the gas pedal, slow it down, make things more reasonable, and talk to your teens. They don't have their friends and their teachers and anyone at school or sports to just spontaneously talk to. And never underestimate how important you are to your child. So talk to them, but more than that actually is listen to them. Get curious about them beyond just their role as a student, because there's so much more than that. And don't try to fix it. Don't try to reassure them, at least not right away. Don't try to compare it to anything else. Just listen and kind of get into the tough feelings with them. Just give them a lot of empathy. And for parents too, a lot of self-compassion and kindness goes a long way. This is hard.
Kathy, last minute to you on that. A lot of kids are not communicative, particularly with their parents. So how should parents handle that?
Yeah, it's a great question. And here's the reality as a survivor of the teen years with two adult kids myself. And this is true. Kids aren't, it doesn't matter how wonderful you are as a parent, kids aren't going to tell you everything. There's things that they just aren't going to tell you. And I think that's okay. And when what we see at Kids Help Phone is about 56% of the kids that speak to us, they say 56% tell us something they would not have told somebody else. So I think just relax about the fact that your kids may not tell you everything. Make sure that they have avenues to tell somebody something. Make sure they have Kids Help Phone. That is a plug for our service. But if I could also put a big banner of hope out there for us all. And if we look to young people for that hope, there is an enormous amount of resilience in our kids. And we see that every day. And we talked earlier about 4,200 active rescues. Here's the hope side of that horrific statistic, is that those kids are the ones that picked up the phone and called us. So I think that is a beacon of hope. And we should follow the lead of our kids and reach out if we as adults also.
Amen to that. Kathy Hay from the Kids Help Phone, Javeed Sukhera from Western University, Sheri Turrell, Life in Balance Therapy. Thanks to the three of you for sharing so much good wisdom with us and our viewers and listeners tonight here on TVO. Take good care, everyone.
Thank you.
Thank you.
You too.
Be well.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.